Hi guys, welcome back to the second part of antifungal drugs. So in this video, we'll be dealing with the classification. That is, depending upon the chemical structure and clinical use, antifungal drugs are mainly classified into antibiotics, antimetabolites, azoles, allylamines, thiocarbamates, and miscellaneous agents. So antibiotics, antimetabolites, azoles, allylamines, thiocarbamate, and miscellaneous agents. So the classification according to the route of administration, that is for systemic infection, we will be using griseofulvin, amphotericin B, ketoconazole, fluconazole, and terbinafine. And for the topical, like in candidiasis, we'll be using choline, macrolides, triazoles, imidazoles, gentian violet, etc. So depending upon the mechanism of action of antifungal agents, that is the drugs which disrupt the fungal cell membrane. That is, cell membrane is very essential for the normal living of the fungus. So these drugs inhibit the cell membrane. That is polyenes, azoles, and allylamines. And the next is those who disrupt the fungal cell wall. So the protection is lost. That is the echinocandins, that is capsofungin. And the third one is who is disrupting the microtubule function. That is microtubule formation is very much needed for the cell division and the cell multiplication and replication. So they are the griseofulvins. And the next is those who inhibit the nucleic acid synthesis. Nucleic acid very much essential needed for the biosynthesis of other molecules and for protein translation and all. So cytosine will be inhibiting the nucleic acid synthesis inside the fungus. So this is the mechanism. So the first one is the antibiotic, that is the polyene antibiotics. They are polycyclic esters, that is they will be having many double bonds, multiple double bonds. That is the name polyene. And they are obtained from the various strains of actinomyces bacteria. Usually they have high affinity to ergosterol. That's why they are acting on the cell membrane of fungi. And they induce leakiness of molecules that leads to the destabilization of the fungi cell. So the first compound is amphotericin B, very important and this is very important compound used in the fungal treatment. It's obtained from Streptomyces nodosus, and AMB has a large macrolide or macrocyclic ring because of the double bond structure. Sodium deoxycholate is a solubilizing agent and is commercially available powder for the injection. It has very high affinity for the ergosterol present in the fungal cell membrane, and it binds to the ergosterol and they produce a pore-like structure. It is known as micropore. Through this micropore, the material inside the cell goes out. So there is a destabilization of the cellular ions. So there is leakageness, membrane permeability is lost, the K plus and H plus ion exchange occurs, amino acids and sugars from the cell is lost, that leads to the irreversible damage resulting in cell death. So cholesterol present in the host cell membrane closely resembles the ergosterol. That is the problem with amphotericin B. Sometimes it binds to the cholesterol present in the human or animal host cell membrane and produce small problems. That is, affinity for cholesterol is very less, but sometimes they can produce systemic toxicity. AMB is one of the most toxic systemically used antibiotic. Bacteria do not have sterols and no problem with polyene administration in bacteria. This has got some immunomodulatory action, that is potentiate cell mediated and humoral immunity. AMB is fungi static. They will be making fungi stasis at normal dose, and at higher doses they will be killing. So the spectrum of activity, polyenes have a broad spectrum of antifungal activity. That is, they act against Candida, Histoplasma, Cryptococcus, Coccidioides, Immitis, and many strains of Aspergillus and Blastomyces. No active antibacterial activity because they are actively against the ergosterol. No anti-rickettsial activity, no antiviral activity, but they are active against Leishmania. This is a very important point. So the resistance, they have resistance towards many other ergosterol products. So the pharmacokinetics extensively bound to plasma proteins and poorly absorbed from the GI tract. It can also be given as orally only to the GI tract fungal infection treatment. So the adverse effect, there is some adverse effect with the amphotericin B treatment, that is mainly the nephrotoxicity, as they will be producing leakage by producing the renal tubular cell membrane. They will be producing decreased glomerular filtration rate due to increased production of eicosanoid synthesis in renal blood vessels. So these are the adverse effects of the AMB treatment. Uses. It's most effective during the various type of systemic mycosis infection, oral candidiasis infection, thrush infection, cutaneous and mucocutaneous candidiasis can also be treated. It is also used to treatment of Kala-Azar and mucocutaneous leishmaniasis. So this is the dose. Drug interactions. Flucytosine has supra-additive or synergistic action with the AMP. That is, flucytosine is the anti-metabolic antifungal drug. So it should not be combined with other nephrotoxic drug because this drug already induces nephrotoxicity. And if you are giving other aminoglycosides, antibiotics or loop diuretic means the kidney will be gone. Actually, the kidney will be having many problems with these interaction drugs. This is the contraindications, that is renal insufficiency. You should not be using in hypersensitivity patients. You should not use it whenever you are treated in the diuretics treatment. Use should be very less. So then the next drug is nystatin, that is produced by Streptomyces noutsi, and this is not of much interest. This is the natamycin. This is obtained from Streptomyces natiliensis. Less irritating to the eye than AMP actually. So you should read fungal keratitis and eye infections in animals and human beings. This is also used to treat Candida, Aspergillus, Cephalosporium, Fusarium, and Penicillium. It's also having a broad spectrum of action. Next one is hamycin, that is Streptomycin pimprina. This is used to treat mainly Trichomonas vaginitis and cutaneous candidiasis. So the next group is heterocyclic benzofurans. This group is having griseofulvin, which is a very important drug. This is fungi static. They will be inhibiting the properties of fungi and the normal cycle will be decreased. They are used to treat the superficial as well as systemic mycosis. So the griseofulvin is a fungistatic drug that enters the fungi via an energy-dependent transport system. Inside the fungal cell or the fungal cell, griseofulvin binds to the polymerized microtubules and disorients them. Thus, microtubular formation decreases. The cytoskeletal elements in the cell will be not formed. So, eventually they get arrested at the metaphase and produce abnormal metaphase configuration that leads to problematic cell mitosis that leads to the lower level of fungal cells. So the daughter nuclei fail to move apart or move only a short distance, result in multinucleated and stunted fungal hyphae. That is curling phenomenon, which is very important in case of brachiopulvin, curling phenomenon. So the resistance spectrum of activity you can see, it is used against dermatophytosis, that is mainly in the ringworm infection. So the pharmacokinetics is variably and erratically absorbed. Brachiopulvin gets deposited in the keratin forming cells of skin and hair. This is a very important problem with the use of brachiopulvin. Since it is fungistatic and not fungicidal, that is, they will be not be killing the fungal, but they will be inhibiting the fungal activity. The newly formed keratin is not invaded by the function, or the fungus will not be invading the newly formed keratin layer. So the problem is griseofulvin induces hepatic cytochrome P450 activity and can increase the rate of metabolism of a number of drugs, including oral anticoagulants. Main clinical use is against dermatophytic fungal infections in dogs, cats, goats, etc. So the dose is this. So side effects. At very high doses, it may produce teratogenic and carcinogenic effect in the cats. This is the very important point in case of cats. If given during the first trimester of gestation, that is whenever we are administering this drug to a pregnant animal which is in the first trimester of gestation, it may produce cleft palate and skeletal and CNS abnormalities, mainly in cats. Griseofulvin may also cause hepatotoxicity when it is contraindicated in patients with intermittent porphyria. So the third one is echinocandins, the newest group of antifungal drugs which inhibits synthesis of fungal cell wall. Actually, they inhibit the formation of fungal cell wall. And thus they are called penicillins of antifungal drugs because penicillins always inhibit the cell wall synthesis in bacteria. This is fungistatic activity against Aspergillus species and fungicidal activity against most Candida species. So you have to study the second sentence, that is fungistatic activity against aspergillosis. So efficacious for the treatment of esophageal candidiasis, candidemia, etc. Caspofungin, micafungin, and idulafungin is the main example. So the mechanism of action is they will be inhibiting the activity of glucan synthase complex. That is beta-1,3 glucan and chitin is the main components in the cell wall. They will be inhibiting the glucan formation. Thus, relatively selective because glucan synthase enzyme is not present in mammalian cell. So, glucan synthase is inhibited at the fungal cell and no glucan is synthesized. So, what happens? No glucan is formed. No cell wall will be functioning in case of the fungus. So, easily they can be phagocytosed. Due to the large molecular weight of echinocandins, they have poor or oral bioavailability and are administered by IV fusion. This is a very important sentence. You have to study this. And not an inhibitor, inducer, or substrate of cytochrome P450. So the next drug is anti-metabolites. That is flucytosine. That is, they will be inhibiting the DNA synthesis or the inside the nucleus. They will be having the action. So 5-flucytosine is a fluorinated analog of cytosine, earlier used as an anti-cancer agent and later proved to have potent action against Cryptococcus. It is synthetic pyrimidine antimetabolite. So the pyrimidines will not be formed, or the pyrimidines will be functioning in a bad manner, so that proper DNA replication and DNA formation will not be there. So the mode of action is flucytosine enters the fungal cells via cytosine specific permease enzyme. Then 5-flucytosine will be acting at 5-fluoro cell within the fungal cell by cytosine deaminase. They will be deaminasing the cytosine, and the proper cytosine will not be having the greatest effect, and it will be inhibiting the DNA synthesis and inhibiting the diamidelic acid, which is the component of fungal DNA. So they will be inhibiting the DNA synthesis. 5-flucytosine either is incorporated into the RNA or disrupting protein synthesis. Selective toxicity, mammalian cells lack the cytosine permease, so no problem with the mammalian cell. Hence selectivity toxic to fungi and not to the host. So this is very important drug to use in case of antifungal. Whenever flucytosine is used with the amphotericin B, that is in combination with amphotericin B, to increase the concentration of inside the antifungal cells, this combination is very synergetic. That is, they can act into the fungi and kill more number of fungi. This leads to the synergetic action. So it is a narrow spectrum fungistatic drug. Toxicity is very less than AMP. Alopecia in dogs and seizure in cats are the main problems. So these are the examples of drug used in antibiotic antifungals and anti-metabolic antifungals. See amphotericin B, caspofungin, griseofulvin, natamycin, nystatin, flucytosine, flucytosine, griseofulvin, nystatin cream. So thank you. Wait for the part 3 antifungal drugs. Thank you guys.